Should men diagnosed with cancer receive the COVID-19 vaccine?
Yes, absolutely. I'm a strong advocate of the COVID vaccination. So men with cancer absolutely should receive the COVID-19 vaccination. There are very few contraindications to getting COVID-19 vaccination. I think it's really important that everybody, especially patients with chronic medical conditions, get the COVID-19 vaccination. I think it's the concern that I have is if folks are avoiding getting vaccinated because they're worried that they have an underlying medical condition, what I would say is that if you were to get infected with COVID-19 infection, you would be at more risk of having a complication because of being debilitated due to an underlying medical complication. So if you have any questions, ask your doctor, but absolutely you should get vaccinated. I know there's a lot of information out there on the internet, Facebook included, where people are calling into question and trying to create a controversy about the vaccination. When you look at the sort of the straight up the medical community, there's very little, if any, controversy about this. We all think this is the best thing. You absolutely should get vaccinated. You ask any doctor who practices medicine. Yes, I know there are people who have MD behind their names that are saying some strange things on the internet. My friends show me their articles, and these are not practicing physicians that are treating patients that are really looking at the science behind it. I understand there is still a lot of fear and concern because it's, especially with the mRNA vaccines, that they're new and a little bit different. The science for them has been around for years. It's just been mass produced now because there was a need and it was the fastest way to get the vaccines out. We've now given somewhere between 2 to 3 billion shots worldwide, and we are tracking side effects and complications related to the vaccines very closely. I myself had to fill out questionnaires for 2 months. I was getting them on my cell phone. How are you checking in? Are you having any side effects? How do you feel? So this is one of the most studied vaccines worldwide, and the side effect rates are incredibly low. We hear about them on the news. We've heard about them when there's 6 cases of this or 12 cases of that. And that's because they're newsworthy, because they are actually so rare. This does seem to be an incredibly safe and effective vaccine, and I recommend everybody get it.
So do I. Early on when I got my vaccine, I was super excited because I knew that I'd be able to help protect my patients who are cancer patients. And those cancer patients are at very high risk of developing complications if they contract COVID. So I was really pushing as early as possible for my patients, especially the newly diagnosed patients who had cancer, who had recently been diagnosed with cancer. Particularly patients who've gotten treatment for cancer like radiation or chemotherapy are at extremely high risk of complications if they develop the COVID. So it's certainly something that I recommend to all patients, but to patients with cancer in particular.